This is one of those cutting-edge conversations that especially interests me since I have young grandchildren, and it's unique in a sense. And I was so happy to meet Dr. Larry Lampert, who is a developmental behavioral optometrist, and he actually has his office in Boca Raton. I met him, of course, when he was at Regents Park helping the older adults, because with the what he does with vision, and he can talk to about that for a minute, can help people from falling. And that's what we want for older people. So welcome to our show, Larry Lampert.
Hello, Anita. How are you?
I'm great. I'm so glad you've come in here. And it is true, isn't it, that falling, I used to think it was just because something was wrong with their brain or they slipped or something, but a lot of it's vision, isn't it?
Mm-hmm. Yeah, 20% of your vision actually goes to your balancing centers. And recently, 2 studies were released that showed that a weakened binocular system, that means the eyes work together, but the way they hold together over time as we age has weakened, is more of a risk factor for falls than cataracts or macular degeneration. So at Regents Park, we have a program where we look for these things. When we find them, we build it into the occupational and physical therapy to help develop the visual skills, bring them to more youthful levels, and then hopefully prevent a fall down the road.
Now, of course, you've been helping Bill. You've also been helping me. I'm sure whatever's happening, and we can talk about what you're doing, is going to benefit me. But the most important thing is to benefit Bill, because he has the macular degeneration in one eye, and he struggles with that. But I'm watching his, being very careful, and I don't know what he sees and what he doesn't see. But what is it doing for him?
Well, in macular degeneration, you still have your peripheral vision intact in most cases. 20% of that system goes to balancing, and that's the system that lets us know where we are and where things are in space. Think about when you walk through the doorway. You don't study it consciously. You walk through a doorway and you don't bang into it. That's a peripheral vision skill. So even in macular degeneration, we can enhance those skills and increase what's called the useful field of view. In other words, just improve the acuity or the awareness of the peripheral system in these patients and improve their safety.
And I laugh because it's so simple. It's just done with glasses, and of course Larry can explain what happens with the glasses. And Sharon, who is a spectacular administrator that you have, she's your tech, I guess.
Yeah, and they're not just any glasses; they're special yoked prism glasses, which means they're prisms, and we rotate them in certain orientations, and the lenses, when they're oriented like that, actually work on the peripheral processing. So sometimes we'll work on peripheral processing. Patient without macular degeneration will use these prisms to work on the eye teaming or the eye muscle system, which as they hold together better, you improve or decrease your risk for falls.
Well, I'm going to talk about someone. I'm not going to give her name, but I did meet her recently, and she's in her late 70s. She's a brilliant woman, and she apparently had some one eyes crossed before when she was younger.
Yeah.
And it seems that she's been aging. It's been starting again. And she goes for the same kind of, I guess, work that you provide there. And she said it's really making a difference. The eyes now the one eye is moving back.
Right. We just have to train the center vision of the right eye to work with the center vision of the left eye, and the peripheral vision of the right eye to work with the peripheral vision of the left eye. And a lot of times as the eye starts to turn in, the brain will wire a little differently and use the center vision, say, of the right eye with the side vision of the left instead of center with center. So it's all about doing drills and exercises that reinforce the brain pathways to use the center of the right eye with the center of the left eye and the periphery of the right eye with the periphery of the left eye. And that's what we do.
So with your optometric education, you actually can record this and know what's happening. So after 2 weeks, 4 weeks, 2 months, you can see the differences. Sometimes it's not visual, is it? You actually see it in a test.
Right. Yeah, there'll be tests I take in the office where I measure the angles between the eyes. I measure how the center is working with the periphery of the eye. And I can measure how the eye muscles hold the eyes together as a team and tell that we're strengthening them over time.
All right, so now let me just tell you, when I've been there before, I was a little amazed. I saw some children sitting there, and I thought they were just waiting for their grandparents. But they weren't. You told me they were patients. Tell me what they were doing there.
Well, there's a lot of children that have undetected vision problems that are affecting them in the classroom. In fact, it's about 25% of children in our classrooms today. And most of the time, these problems don't have to do with how they read an eye chart. It's not about being 20/20 or not. It's about how their eyes work as a tool, or how their eye works as a sense for them, how they focus back and forth from the board to the paper, how their eyes track when reading. Do they tend to skip over words or reread words, or do things go in and out of focus? And a lot of times the children won't report that to the parents because they don't think it's abnormal. You know, it's what they've experienced their whole life. So I have met children that see double, and they don't report it to the parents. I actually had one child that said while her mother was sitting in the corner of the exam room that after she reads a book for about 5 minutes, there becomes 2 books. And I said, well, how do you read? And she said, well, I just ignore the book on the right. And that's how I read. And I said to the mother, did she ever tell you that? And the mother said, no, she never told me that. And the child said, well, it happens to everybody, doesn't it? So the children don't know when that's going on. But these are called visual processing or visual skills or developmental vision problems, and we address them. And again, many of them have nothing to do with the 20/20 part of the eye.
So when they're examined, and the particular person examining them is not your skill, and so they're not seeing the same thing you're seeing.
They're undetected because a lot of people just don't have the training and background in how to do these type of exams or what to look for. So basically, an eye exam will be, well, my child is 20/20, or my child is 20/20 with their glasses, so there's nothing else wrong. This is hit a lot even in the U.S. Army, where the soldiers were coming back with the concussions, and the eye doctors were clearing them and saying, well, they're 20/20 and there's no damage to the eyeball as an organ. But these women and men who had had the concussions overseas had visual processing, visual perceptual problems that are now being picked up by the U.S. Army at Walter Reed and 4 other centers, where there's optometric specialty clinics geared towards picking up these things. So it's different testing than that has been traditionally done in the eye doctor's office.
So let's say that a child does come in, and how are you going to detect there's a problem?
Well, of course, I'm going to check acuity and do all the things that are required in a normal eye exam, make sure the eyes are healthy. Beyond that, I'm going to look at their focusing skills, how well the eyes hold together as a team. I'm going to do a visual tracking test, which will tell me how are their eyes move along print in a page. You know, do they skip words? Do they tend to reread words, or does it just take them too long? And that test uses numbers. So as long as a child knows 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, they can take the test, and they don't have to have the cognition to understand a word. So we'll see, do they take longer than they should for their age, or do they make more mistakes than they should for their age? And then we know we have a visual tracking problem.
Well, you know, Larry, thinking about this, let's just say what you were talking about, that they don't know something's wrong because they've never seen a different way. So, Larry, that must be very difficult on their personality and it could make a difference in their self-esteem, I would think.
Definitely. I mean, a lot of times these are smart children, but they're not performing as well as they should in a classroom, and their self-esteem goes down. They start to think they're not smart, or they think they're stupid when they're really not. It's just because their eyes and their brain aren't working for them the way they should to, handle the demands of the classroom.
So you have a child that comes in. Tell me the procedure of what you do and where you're going to go with it and what happens and maybe how long you can start seeing progress.
Okay. That's a long question with a long answer. My exam begins in the waiting room. I pick up every child out in the waiting room, and even then I'm observing their behaviors. How are they with the parents? What are they doing? Are they playing? And I bring them back to the exam room, and I'll check the acuities, but I'll do it a little differently than just what's the line you can read on a chart. I'll go see if I look at an individual letter, do they see it better than they do a whole line or a whole chart, called a crowding phenomenon. So sometimes their eyes have a hard time focusing in on things. Then I look at how their eyes hold together as a team. I'll make them see double, and I want them to let me know when they line up things vertically, when they line up things horizontally. This gives me an idea of how hard the eye muscles have to work to hold the eyes together as a team. Then I do another test where I put stress in front of the eyes with rotary prisms in a machine, and they have to tell me when what they're looking at goes double, and then when they can put it back together into one. And these are called fusional ranges. This will let me know how well a child's eyes hold together as a team for the demand of, running, reading, looking through print, not skipping words, things like that, and even baseball and sports performance. And then I look at how does the system focus back and forth from board to paper through different tests I do. And then also how well does a child hold their focus at the plane of a book. We all do these eye exams out at 20 feet for glasses. I do a second eye exam in at the distance that a child reads a book or works on a computer to see what's happening with the eyes and how they're focusing and other things like that.
Okay, so now you've seen this. Now what do you do?
Well, now, if needed, we can work with specialty prescribed glasses or lenses called developmental lenses. Sometimes that's all a child needs to kind of jumpstart the system, kind of like braces on teeth. They're not glasses for seeing the board. They're glasses to help develop the system just like you would guide the teeth with braces. And we'll see if we can guide the focusing system and the central peripheral vision integration to have them be able to track and focus and stay focused better. And then beyond that is actually visual skills training or vision therapy, where we bring a child in and they work with Sharon in my office, who's like a physical therapist for the eyes. She's a vision therapist. And we'll work with lenses, prisms, filters, different exercises, things that we present as games, but they're really working on the visual processing system, whether it be the visual skills, tracking, focusing, eye alignment, or the visual perceptual skills like visual memory, visual construct, and different areas like that.
Okay, so tell me about the success rate. And tell me, you can imagine a parent brings their child in and frustrated, they're not reading up to the par, but they're a great kid. And tell me what happens then when it takes, a month, 2 months, whatever. Then
it's
the parents, what do? They must
they're
jump
happy.
Up and down.
They feel like they have a new child. And the child is happy. Not only do I look for in my exam the improvements in the measurements I take, but I'm looking for changes in real life, quality of life outcome studies. Are we reading better? Oh, I stopped getting headaches when I read. My child now is reading. I had a child the other week who had 0 words, and within 2 weeks of my therapies was up to now recognizing 36 words.
Okay, wait, and 0 words, and what did that...
Word recognition.
Yeah,
they couldn't recognize...
Why?
Visual,
what did that...
Well, if visual perceptual training helped, I would assume it's the visual perceptual problem the child had that I identified. And then once we fixed it, within 2 weeks, the child was able to identify 36 words that he had never done before in his life, and now is just growing and becoming a reader.
How old was that child about?
7.
7.
Yeah.
And so all that time, that's what the child was living. He couldn't see the words as a word.
Couldn't see them properly, yeah. The biggest thing I see in children who have these type of problems is skipping or substituting small words. And these are words they should know. A lot of the time, the children will know the word, like the word of or if or the. And if you held them up on a 3x5 card or wrote them on the chalkboard, they know the word. But because their eyes are having trouble coordinating and tracking through the print, the eyes tend to skip over those words, and they'll either just omit them or substitute them. So that's the number one thing a parent should look for. Do I have a child who substitute or changes small words?
I can see the frustration of the parents.
And the child.
Yeah. Oh, the child, definitely. Because now the child's either kept back or has to have special tutors or frustrated. And then the parents, they're trying to help them. They love their children. And you could see they say, no, that's not this, it's this. Don't you see that?
I have so many letters from parents that, the listeners, if they want to see them, they could go to my websites, which I have 2. One is drlampert.com, drlampert.com, or the other one is eyeperformance.com, eyeperformance.com, and look at the testimonials, success stories areas, and you can read several of these stories where we just had children who were underperforming, and all of a sudden after fixing the vision skills problems, and again, I emphasize different than just seeing 20/20 on a chart. This is what changed the child's life.
This must be the most exciting thing for you. I know you studied to be an optometrist and you've helped a lot of people, but I would think that, besides all the sports work you do, and it's very important, but when you really get down to it, to take a child who's
Right.
not seeing and can't read, and how many children maybe no one helps them and they're 12 and 14 and they never read, and then they're held back and they can become juveniles.
Change their lives. Oh, juvenile delinquency, that's a whole other area where 80% of them, I think, have these type of vision problems, and I think it's 70-80% of them end up back in jail. And in San Bernardino, when they did, I think 10 years running, when they did visual skills training on these juvenile delinquents, the ones that received the training, only about 20% of them ended up back in jail. So it made a significant difference in their lives. But even the children we're dealing with today, it's so rewarding for me. I've been doing this long enough. My kids are now 26 and 29, so I'm not such a youngster anymore. I've been in practice for a while. And to have the kids coming back to me as adults, maybe even with their own children now, and telling me how it had changed their lives. And I didn't even realize it at the time. I'm working every day and I have passion for what I do. But to come back and say, I'm an engineer now, and I would have never, ever been able to handle that college work if I had never done this eye training as a kid. Another woman who is now a pediatrician of some specialty type. I forget what she does, but basically saying that she just would have never been able to do this if she hadn't had this as a child.
Well, I think we need to put this up on, a huge board somewhere in the world that people, because most people, and that's why we do this. You're on the radio,
Right.
and we try to write the articles.
The biggest thing to overcome is just the lack of awareness of these problems, number one, and these services, and the misconception that if you've been told your child has 20/20 vision, that everything's okay. It doesn't mean everything's okay with their vision. So any child who's having a reading problem, in fact, I think it was the chief of ophthalmology at Harvard Medical School at one point said that these things should even be tried before tutoring, because there were enough of these kids who had these type of problems. But again, the word doesn't get out about it. I mean, I'm trying to do my part. There's about 540 of us in this country that have my fellowship certification in this area, and it's not enough. There's people who don't live anywhere near somebody, and I've developed software, which, in fact, today I'm hoping to sign my agreements where, I'll have an investment team and a technology team so that we can now take it to the public who can't access it through a doctor and make it reasonable and accessible for people, and that's going to be through my eyeperformance.com website.
All right, so now let's say someone decides to come to you and they're ready, and you find this out. Now, what is the treatment? What happens?
They go into a room, assuming we may or may not have worked with developmental lenses, which are basically passive. They just wear them, they go home. And again, I've had children that couldn't hit a baseball within 2 weeks of wearing these things because it helped their depth perception. They're hitting baseballs and things like that. But they come into the office once or twice a week, and they meet with Sharon. And again, Sharon's like a physical therapist for the eyes, and she will exercise their eye muscles for them. We use lenses, prisms, filters, nothing, no electrodes, no drugs or anything like that. It's like a therapy thing where we exercise, if you want to say, the eye muscles that have the eyes converge, meaning cross to read, diverge, uncross to look far away, the focusing system as it looks from board to paper, and we exercise these things with special lenses that the child wears while they're in the therapy session. Now, while they're wearing these lenses, they have to do activities, so we know they're paying attention with their eyes, and these activities are all geared at improving visual perceptual skills, whether they be memory, form constancy. There's all these other little skills that, if you've had IQ testing or whatever on your child, they'll talk about these different visual perceptual areas. So we work those skills as well.
Well, I am just overwhelmed. I've heard this before from you in bits and pieces, but you really did it for me this time. I am so proud of you and what you've come up with, and you're saying that there are about 500 other people who have been trained to do this. Mm-hmm. Why so few?
Because it's a challenge. It's interesting because I think the organization asked students that I have my fellowship through, training through, why don't they pursue this? And the most common answer was, well, I want to go to school and I want to learn. Thinking hurts my head, and this is a thinking person's profession, not somebody who necessarily just learns. If they say they have a headache and they have 5 fingers in XYZ, it's a this or that, and you just give them this medicine. You know what I mean? So you have to be able to think and figure things out, kind of like being a detective to do this kind of work.
Well, but I think we need to double that or triple that.
Yeah,
because
I would agree.
That's because here you must have people all over the world, and that's where I guess you're getting your website set so people could do this.
Yeah.
But so they won't. How will they have an evaluation if they don't live here, and you can't see them? Is the evaluation part of the assessment?
There will be an assessment module in the software that's coming up, so they'll be able to do that. And then even if you look at the fact of just training visual skills, visual skills training. Even without an assessment, just to do it, like you would exercise or walk or exercise your body, has been shown in seniors to reduce car accidents up to 50%, improve braking distance 22 feet at 55 miles an hour. I use it with sports teams. I have the Minnesota Twins, where we've worked with 2 minor league systems. One went up 35 points in team batting average. The other went up 19 points in team batting average by using my software. And these were without exams. It's just basically like, you would go and work out in the gym. You use these exercises to work out your eyes. Now, if you can't do certain exercises, then, you better get to a doctor. And, we're assuming that people have normal, healthy eyes to do them. But you don't need an assessment first to do the exercises. They can just be done as skills enhancement like you would go to the gym.
Well, I could see it. So I want all grandmothers and grandfathers to be listening to this because I know how painful it is for you to have your lovely grandchild who is struggling with certain things in school. And we know that there's so much new stuff out there nowadays. So this is what you have to do. You have to actually get in touch with Dr. Larry Lampert. And the way you do that is you can actually, you can email him, and I'll give you that. You can email him if you had to. It's drlampert@aol.com. But if you want to see his website, and everything he's been telling you, it's drlampert.com. drlampert.com. And I have a lot of fun when I go there, as a matter of fact, because the glasses go on, and I always thought, they're just the glasses. And then when they change the glasses, then I struggle a little bit until my eyes get more relaxed.
Right.
And what that's doing is forcing the muscles to do something different, is what you're saying.
Almost like lifting weights with your eyes. And again, you think about how we work out our body and we exercise and nutrition. Working with the eye, the visual skills in the eye muscles is like anti-aging for the eyes. And it's been shown you can bring visual skills down to much more youthful levels very quickly doing these eye enhancement training exercises and software drills. So that's what we're all about at my office.
So, Larry, we know that infants usually get a hearing test. It's too early to really get a vision test like this from a pediatrician, isn't it?
From a pediatrician, yeah. But if you go to someone who's trained, we can do a 6-month well baby evaluation.
A 6-month?
Yep. And at that point, we can tell if astigmatism is developing. Is it a normal amount of astigmatism, and we don't want to correct it because you'll embed it with the glasses instead of letting it go away? Or do we see certain types of astigmatism or refractive errors that we can tell a mom and dad, just do these exercises? We see a certain type of astigmatism developing, we'll tell mom or dad, let's do things where the baby has to use their eyes vertically, stacking blocks and, make them look up and down, and let's see if we can get rid of the astigmatism that way. With the other kind of astigmatism, we might say we need the child to work in the horizontal plane. Let's work with them moving trucks sideways on the tabletop and things like that, and guide their eyes through various movements that can help to get rid of certain type of astigmatism as it's developing when they're 6 months, 8 months, 12 months, 2 years, 3 years, and just keep an eye on that and try to guide or steer the development of the visual system, again, just like we do with braces on the teeth.
And so for this woman that I said had, her eyes were kind of crossed, I thought people had them operated on. That's not true now? They
still do, but I don't know that everybody who has that operation really needs it. And if you look at the statistics of those operations, by the time people are 22, they've usually had about 3 of them. And you go like, well, if it was such a scientific, exact process and all you really had to do was adjust a muscle to straighten the eyes, why doesn't it work so well? You know what I mean? And where the therapy techniques I use, we feel the problems in the brain, not in the muscles of the eyeball. And that, again, like I explained earlier, the ideal vision system has the center part of the vision. Again, center part of the vision is about the size of a coffee can at arm's length. And then the rest of the way out is all peripheral processing. It's just not way off to the side. Center vision looks at letters on the chart. Peripheral processing helps guide you through doorways. When you're driving down the road for 5 minutes daydreaming, you don't run off the road because you're in that peripheral processing system. So again, a normal system would, the brain would use the center of the right eye with the center of the left eye, and the periphery of the right eye with the periphery of the left. So when the eye is crossing, first of all, these people don't see double because they're shutting off the center part of the vision of the turned eye, and all they're using is the peripheral vision. So now the brain is using, say, the center of the right eye, and if the left eye is turned in, it's using it with the periphery of the left eye instead of the center with the center. And we've just got to try to exercise the neural pathways or the brain pathways to get the brain to use the center of the right with the center left. If the brain uses center right, center left, with the periphery of the right and the periphery of the left, the eyes will be straight.
Voila,
so
just like that.
Right, even if they need eye surgery, it's a good idea to do some of these processes before and after the surgery. It's been shown.
It's so great. I love having you come on the show because this is such cutting-edge new information that most people have never heard and will never hear unless they do speak to you. This is pretty exciting stuff. What have you ever dealt with anyone who's had a stroke?
Oh, yes, all the time, especially at Regents Park where, they'll have visual field losses, midline shift syndromes, and a field loss could be they don't see anything at all to the left with either eye or to the right with either eye. We have procedures to help them with that visual field loss. And then midline shift syndrome means all of a sudden their sense of center goes off to the right or the left a little bit, and they start to veer to the right or the left when they're walking or maybe leaning a little bit. And we work with especially prism lenses to straighten that midline shift and get them balancing and walking better.
And so it's all to do with this. I love it.
Vision.
Well, Larry Lampert, Dr. Lampert, you are a jewel. I love having you on the show. This is such a cutting-edge discussion. Please call if you want more information, 561-479-1411, or go to their website, drlampert, Lampert.com. Thank you so much.
Thank you, Anita.